I love you.
In Fiji, there are about 20,000 children that are born every year, and about 1%, so about 200 children are born every year with congenital heart disease. Now, a congenital heart defect is a defect in the heart that's there from birth. Half to a third of these children, if we don't intervene or do any sort of surgical procedure, these children are going to die.
Since he was born, he was coughing, sneezing every time. The weight was not going up. He was like, every time the weight was going down. And the doctors, they say, you're not feeding him well. But the main thing was something else, no? He was very sick when he was in year 1. For nearly 1 month, he was unable to walk. Cold, fever, asthma. And then I took him to CWM. Then they found out that he got a hole in the heart. He's the only son, and I was really scared. Dr. Ashish, he told me that, no, you don't worry, everything will be fine. It was really hard that day. It was nearly 5 hours operation.
What the doctor told us, it will be a 50-50 because they found 2 sickness from her, that she had a heart failure and a liver problem at the same time. And what the doctor told us, we'll try our best that she could be alive and just be hope. That's the only word that the doctor told us. Even myself, I never take her give her for the doctors and the nurse. My elder sister gave her to them because I'm really feeling emotional. I can see them and she was fully crying.
Pediatric cardiac surgeries, highly skilled. You need surgeons who require lots of years of training and a full team of specialists. So by collaborating with the Sanjeevani hospitals, the Sai Prema Foundation was able to undertake the first lot of surgeries in August 2016.
Experience working here in Fiji has been fantastic. I think what I really enjoyed about it is that teams came from all over and it was like an instant connection. And I think when you're working with people who are really good at what they do, it automatically flows from there. It's a special feeling. It's a feeling you don't get from even doing anything else. It's just looking at the patients and looking at the patients' families. I think they've actually given you more than you've given them, and so that's I think what makes this really worthwhile. So it's something we do every day, but especially doing it in this situation, this context, it really means a lot. I think the Sai Prema Foundation it should be the pinnacle of what any country should be doing. They not only are they looking in healthcare, but they're looking for care for the human being is basically what they're doing. And I think That starts with them, but I also think the government has helped too, and having everything come together. They're doing a lot of great things in such a short amount of time, and I think this is just one little glimpse of what's going to happen in the future.
The local team as well, the Fiji team, has been amazing. The staff are so keen to learn, and I think as an ongoing program, if we can have some of those key people come into our team and work with us consistently over the years that we come, you'll have some fantastic people to be able to keep an ongoing program. This is exactly what Fiji needs. I have been here in Fiji in the 1990s with another team who's been coming here for quite a few years. But I think it's actually time for Fiji to be able to have something that's sustainable and their own, which they could also share with other Pacific islands like Vanuatu and Solomons and so on. The cost of sending children to Australia and New Zealand is very prohibitive, so it's been a long time coming, and I think it'll be amazing for them and something that they really, really need here, and all of the Pacific.
The team here are marvellous. It's been such an international team, although we all work together beautifully. So that's probably been the main thing. So we've had people from various countries throughout the world, plus the local Fijian people who are absolutely beautiful, and just everyone pulled in, did what we had to do, and we managed to do a large number of surgeries and procedures, which was lovely. The children are amazing. And they are so, I don't know, how do I explain it? Compared to coming from like Australia, where we're predominantly white population, I suppose, and we have all of the resources available, these children just breeze through their surgery. Here they just get up the next day, walk around with their drains in, they get their drains out, no, pain relief, pre-drain removal, and yes, it hurts a little, they cry, but then they're up and about, and it's amazing. And they're so friendly. The whole purpose of this mission is to actually try and start to teach the local people to be able to contribute to the surgeries and to the recovery. And I think that's where it should go. It should go back to, we come over, we assist and support, but for the future, it's letting the local people do the work themselves. And I can't wait to see the day where we just come over and watch. And it's all done by everybody here in Fiji, and we're just here to watch what's happening. That would be beautiful to see.
I enjoyed working with them, and with this team especially, they teach us they involve the nurses, the doctors, the cardiologist take his time out to teach us echo. So I really enjoy that, working with this team, and I think they enjoy working with us too. I think what we've all achieved as a team is unmeasurable. It means so much to the families. One cardiac surgery can cost up to 100,000 Fijian dollars, and with that money we might be able to send only few for surgery overseas.
Really impressed with the fact that that these people, that everybody who's here is so good at what they do, that everybody will adapt to each other, and the outcomes and the work has been exceptional. Everybody knew their job, and everybody's doing their job, and everybody is at the top of their game. There is a tremendous effort going into the kids, into this operation here. I'm so impressed that all aspects, from the screening to the kids leaving the hospital, and then after, it seems like a lot of work has been put into every aspect, rather than get them in, get their operation, and then send them on their way. There's a real effort to make this someday be a sustainable program. And in all these hospitals that I've worked at, the goal is always sustainability. But you can see that it's going to happen here. The government is behind it. The foundation is unbelievable. There's just so many things that are stacked in the favor of the success of pediatric cardiac surgery here that I feel like it's going to happen.
Sai Prema Foundation are committed for the long term with regards to this Gift of Life project. So this year will be the third time that the international team of medical professionals is going to come and do the free heart surgeries. We're also opening a cardiac screening centre within our Sanjeevani Medical Centre, which means that we'll be able to screen more children and create a database of children. It just becomes easier in terms of identifying these children and then providing treatment for them. We are also looking at a children's heart hospital in the near future because the foundation has realised that we do need a local solution to this problem. Yes, there are visiting teams and they do a great job, but really at the end of the day, our country needs its own people to be able to look after our children. So the solution to that is to open our own children's heart hospital, of course in collaboration with the Ministry of Health and also with our sister hospitals in India, the Sanjeevani Hospital, who will help us with training and will help us with all the other technical support.
Now I can see the difference. From then, he never became sick like before. He can eat anything he wants. He can run, he can play soccer, he can ride the bicycle, everything. And now I'm really happy.
From that April 11th till today, we never admitted in the hospital. We never went back to the hospital or even sickness. Whenever she's fever, just take the Panadol in the fridge, give it to her, finished.
When she walks to school, she'll sing with other children. And playing too, she can involve in other activities outside, like playing basketball, volleyball, and all other different kind of sports we involve with. So that's a big changes we see her from the day she had already have operation till now. So we are so happy with her, and also she's a very good girl too.
I work at Shri Sathya Sai Sanjeevani Hospital at Naya Raipur in India. As you know, it's an exclusively pediatric cardiac facility where all services are rendered for free, irrespective of the caste, color, religion, nationality. Everyone is welcome, and we serve them as much as we can serve them. The doctors and the nurses whom we worked with are very passionate, very committed, and they feel for the children of Fiji who suffer because there is no pediatric cardiac service available. They entirely depend on the visiting teams. So far there have been teams from Australia and New Zealand and now India. But that's not really the solution. It's like a stopgap. Only very few, a small proportion of these kids get treated during these visits. We should work towards a long-term solution to the problem. More importantly, the skills have to be transferred to the local doctors and nurses and other healthcare practitioners to achieve our long-term goal of a sustainable pediatric cardiac program in Fiji, for Fiji and also other islands in the South Pacific. It's a surreal feeling, be it in India, be it here. A patient is a patient, and you just don't treat the patient, but you have an opportunity to heal the family, because when the child is young and suffering, it's a suffering of the family. He doesn't suffer alone. Everybody who is connected to the child is suffering too, and it's a very humbling experience. And I think as a doctor, it's a great opportunity for me to be able to alleviate some of their suffering.